Hello everyone, welcome to another episode of Momstar Series. This series is basically of all the mothers who are exclusively breastfeeding their babies, and this is the kind of feelings which we share, the journey which they have been through, and we discuss all these things. Hello everyone, welcome to another episode of Momstar Series. Today we have Mrs. Madhumita from Bangalore who has joined us previously she joined me for a breastfeeding counseling for 10 days, and then she joined a re-lactation challenge which we recently started. It's a re-lactation challenge of 15 days. So today basically it is a dual kind of video which we are doing today of the regular breastfeeding counseling and also for the re-lactation challenge. Welcome, Mrs. Madhumita.
Hi, ma'am.
So, Madhumita, first tell me a brief, tell us about yourself.
Yeah, I'm Madhumita. I'm basically from Bangalore. I'm 34 years old now. Okay, and I have a baby boy who's 4 months old now. So, actually, I got pregnant for the first time. This is my first kid.
Okay, that's good. So, Madhumita, what was your biggest challenge in the breastfeeding journey?
Initially, I didn't face any challenge as such for the first 3 months, or at least I can say till 3.5 months. Everything was going smooth. Suddenly, I was exclusively breastfeeding my baby. I didn't have any challenges. The milk supply was very good and everything. Suddenly, around 3.5 months, what happened? I saw a sharp reduction in the milk supply, and I could feel that the milk supply is also less when I'm feeding the baby, or even when I pump. Earlier, when I used to pump, I used to easily express around 80 to 100 ml milk also. But when I around 3.5 months, when I pumped, even pumping 10 to 20 ml was very difficult for me. After 10-15 minutes also, if I see only 10 or 20 ml only, I was able to pump. So that was a biggest challenge for me, because I was somewhat fixed that I should not give formula for my baby. I was very sure about it. But when I saw a sudden reduction, it was like alarming for me, and I didn't want to give formula, but there's no other go. Baby is crying out of hunger. You will have to feed an alternative, right? So I had to give just one feed a day. I used to give 30 ml. That too, not much. I gave him like for 4 or 5 days, not more than that.
Yeah, but that was a very good time when you reached out, because that was just the starting. If that time you didn't take any action there, this gap would have started increasing and you would have like depended more on the formula. So that was a very good time when you reached out to somebody that, okay, I need that kind of guidance into that, right? That time.
Yeah, actually, I should say, because I initially, before that, I think around when he was 2 months old, I reached out to you for this, because my baby was facing this colic issue, and that's latching problem also he had. So that's when I reached out to you around in the month of 2 months. I consulted you, and you taught me how to do this cross cradle position and all. It was helpful for me. I started feeding him in that position itself for continue. From then, even now, I'm feeding him in that position only. After that, when I saw this re-lactation program, and suddenly that is when I faced the challenge also. The timing was somewhat coincidence. So I reached out to you again for this program so that I can join this program and see if it helps me out.
So, like you are the first one whom we are discussing about the re-lactation program. So, it is a good time that we can take a review from you about the re-lactation program also. This is something which I have done for the first time, and I have not seen any kind of these challenges before. Have you seen any kind of challenges before like these?
like this. That's what I told it was very new to me, because everything was smooth for me till 3.5 months, the milk supply, because I used to feel the heaviness also. If my baby doesn't say for 4 hours he sleeps, I would feel the heaviness, but suddenly everything dropped. Even for a couple of hours, if I don't feed him also, I would feel the emptiness. So suddenly when I faced that, I was like, I didn't understand why it was so. Also, that is when I saw your relaxation program. Then I thought, okay, I should give it a shot, because instead of giving the formula, I thought this is a better option.
Hmm. Okay. So, what is your review about the relaxation program? How did you find it? Like the whole thing and all that?
See, the plan which you shared me, which you guided me, I felt it was pretty simple only, because most of them was like superfoods which increases our breast milk, like the moringa tablet, and the other tablet which you told me, and even the drink, the mix powder which you asked us to take. All these are like superfoods which increases. So apart from this, I had even followed some of your videos which you had actually shared during ovulation. You said there will be a sharp reduction, so you asked us to take consume few superfoods. So I followed that also, like badam, oatmeal, and fennel seeds. These things you had mentioned. So I was taking that also, so that this helps some, either one or the other, maybe might help, right, to increase the breast milk. That's what my thought was. Any one thing will click and it will work for me. That was only my goal, to increase the breast milk.
Okay, good.
And that helped me, actually speaking. Now I'm not touching the formula box. I'm very happy about it. Actually, even for me, giving formula was very difficult, because I one night he cried a lot. I didn't have a formula or anything. So I thought, okay, the next day at least better I have something in hand. Suppose if it is my breast milk is not sufficient for him, I can feed him formula. But trust me, 2 days I didn't open the box. I didn't want to give him.
Yes.
But I had to somehow, because that 1 week I was facing this low milk supply issue. So in that 1 week, I had to give him like 3 to 4 times. The 230 ml, that was sufficient for me. The other time, I used to take him and latch directly. He used to drink. So that was that's how I managed things. But later, after that 1 week, everything was back to normal, like my milk supply. So now it is not an issue. Where at least when he's not latching properly or drinking, sometimes he's cranky. When I'm pumping, I'm able to pump sufficient milk for him. So I'm happy about it.
Great. So I would like to ask you, like, as you mentioned also, you reached out to me when your child was 2 months. So basically, I would like to know a little more so that our viewers know what is your breastfeeding journey.
Okay. So from the beginning, I was feeding him directly. I used to give direct feed, and apart from direct feed, also I was pumping from initial stage. That is from the first week itself. After the discharge from the hospital, I started pumping, because he had this jaundice thing. So we had to feed him frequently, so that he urinates more frequently. So doctor had prescribed for me this. That is why I started pumping, or else I wouldn't have started pumping. So mostly I used to breastfeed him 8 to 9 times a day, pumping maximum 1 or 2 times if needed. Only initial stages I regularly used pump. After that, whenever it was required, whenever he doesn't latch properly or he's cranky, only then I used to use the pump, or else I was not using the pump.
Okay. So this happened, and then at 2 months, what happened that you reached out to me? What happened at that time?
Yeah, at 2 months, what happened was, um, by 1.5 month itself, my baby started having this colic issue. So when I reached out to the doctor, my pediatrician, what he told was, he asked me to first feed the baby, and next, if he's doesn't calm down, he asked me to swaddle. If that also doesn't work, then he asked me to use a traditional jula, that swing, to soothe the baby. If that also doesn't work, the final thing what he gave me was the colic drops. He asked me to give the baby. So I was doing that. That's when I came across your Instagram post and other things, that main issue for colic was latching issue.
Yes.
If that is corrected, you need not give any medication to the baby. So obviously I didn't want to give any medication, external medication for him, because medicines, it is how much ever we reduce, that is more, that is good for the baby, at least in this stage, I would say. So that is why I reached out to you, so to cut down that colic drops which I was giving to my baby, so that if I correct the latching issue, this colic issue will come down. That is why I reached out to you first. Before that, I was not giving him in the cross cradle position. I was using a different position. Even if I was using the cross cradle position, the latching was not the deep latch.
Yes. You
Deep
also
latch
told
was
me
not
that
there.
I
Yeah.
tried the cross cradle hold also. So I
Yeah.
said that, okay, you would have tried, but I need that video. I need to see once.
Yeah.
You
Right.
told me in your counsel that when we were discussing that I am already following that also. So I said, no,
Yeah.
you send me the video. I need to see
Yeah.
once. Yeah.
Yeah, I initially, even I was like, for that first 1 week, I was like, even in the starting, I was like, I'm double minded,
Yes.
whether it will work or not, because he used to latch, but again he used to not go for a shallow latch back. Okay, he used to go back, take his head back. Okay, so I was wondering whether it will work, but slowly, trying. I used to take out again. I used to try the deep latch. Some Finally, after a week, I could notice that he's trying to deep latch. Then it
Here
worked
I
out.
would like to pause you, and I would like to tell all the viewers and all the mothers, because this I hear very frequently. Ma'am, nahi ho raha hai. Baby is not taking. What to do? Many a times mothers tell me, ma'am, आपने technique
Yeah,
बताया तो है, नहीं हो रहा. Baby is not able to take. So
it
I
will work, but it
yes,
takes a lot of time. It
yes,
takes a lot of patience.
yes.
Literally, you have to take the baby out again, try to latch him. That actually, in the night time, it is irritating.
Please,
But
mothers, listen to her because she has been through that. It will come. You need to keep patience, but it is not easy, as Madhu is
yeah,
already telling that. Yes, please, Madhu, please advise, because this is a very common thing which I hear from mothers, that it is not
yeah.
working.
Yeah, daytime at least it's fine. We are not in that irritation, okay? But nighttime it is very difficult. But once again, what happens if we try, if we let go for the shallow latch, they get used to it. So it was difficult for first 1 week. After that, slowly everything changed, and he himself was comfortable with the deep latch.
Yes, because it will be good for him. Because when they will get more milk and it will be easier for them to swallow, slowly the mother will also feel good because the baby will empty the breast frequently. Like very soon it will the baby happening. So mother doesn't have to sit for long hours. So later it will come for both of them. It will be good for both of them. But previously, because the baby and mother have adjusted to that kind of
True.
technique for a long time. So to
Yeah,
teach something new becomes a challenge. But yes,
true.
as you already said, patience and perseverance, this is both very much required into that, and to keep working on to that, and then it is a success.
Yeah.
So this happened. This was your journey for 2.5 months, which was solved that time. And then you, at 3.5 months, you felt again this low supply. That
Yeah.
time, previously, it was not a supply issue. It was just because the baby was taking frequent feeds, I think. You know? That
Yeah.
was the issue.
Yeah,
And colic.
mainly it was a colic issue.
Yes.
That's when I saw your video on Instagram saying that no need of any medication. Just when you correct your latching position, the colic gets resolved. That was my main thing at that time. My main concern.
Okay, so this low milk supply came later on
Yeah.
because 3 months is the growth spurt. Everybody listen, 3 months is the growth spurt, and that is a very important, crucial time when most of the babies go on the formula feeds, because mothers don't know at that time, because 3 months is a growth spurt period. That time, what happens? The baby's demand increase. So mother feels that my milk is not sufficient for the child. Now mother knew about these things, so it is good for her that she reached out and she saw this challenge and she enrolled into that. But sometimes mothers don't know about it, and then what happens, they feel that the supply has gone low, and they sometimes supplement with formula because the baby is crying. Obviously the baby has grown up, the baby starts crying, and then she doesn't understand what happens. So this was a time period at 3 months, then when the babies have their growth spurt, and then again at 5 months. At 5 months, again the growth spurt will come. So these 2 times are very important. Okay. So you joined this challenge, and obviously now we are on the second week. We are running, like last 5 days still are remaining, and you have achieved this. So this is such a nice thing. Okay. So I would like to know what was your experience with me? How did you manage? Like,
Yeah.
as a doctor, many people have something in their mind. So how was your experience with me?
My experience first initially was that's what, when 1.5 2 months, that time itself I felt very comfortable because we had the first main session and then 2 follow-ups, I think.
Yes.
That time itself we had a good follow-up, and you were continuously checking on me whether it was working for me, and it was helpful. And one more main my thing was, I was able to reach you out easily on WhatsApp also. My concerns were answered. So the communication wise and with between us was very comfortable. That is why when I saw this re-lactation challenge, this especially for me, it was a breast milk increase challenge. Yeah. So when I saw this, I was like, I was thinking initially, but when I saw a sudden reduction, then I thought, okay, I have to take a go. And I knew that I will get a proper assistance because initially also I had consulted you. So the same way I had lot of queries in between. I used to
Yes.
message you separately, personally, and ask you too many things, and you were answering all the queries. Even now I have few queries. Whenever I have queries, I message you separately and I get answered all of for those queries.
Last thing I would like to ask you, what message you would like to give to expectant mothers? First, I will ask the expectant mothers.
See, expected mothers, first thing, everything, when I came into this new motherhood thing, everything was like different for me. So I understand the mindset, everything, something will be very new to the people for the first time who get conceived, right? So be calm. It will work out for everyone. See, breastfeeding journey is normal, so everything will work out normally. If in case there is any issue, we have so many home remedies like you have shared with us, and other medications also which will help us. If it doesn't work, don't hesitate to give formula. We don't need to pressurize. Actually, I'll frankly tell you, I was so much pressurized that I should not give formula, I should not. That tension itself was causing a lot of stress in me.
Last thing I would like to just listen, Hannah talk. Is it okay with you? Do you have
Yeah,
time for
yeah,
that?
yes,
Yeah.
yes.
So I would like to just discuss this 15 days challenge which we are doing, because I am discussing with somebody for the first time. You are the only one right now in participating into that, and I can take a review of that. So as you are seeing the other mothers also into the journey, okay, there are many challenges. Some are really struggling with some few drops of milk. So what is your say about this kind of challenge?
See, when I heard others talking, when we had these calls, we have a follow-up calls on every 5 days, right? When I say heard, no, even when say, for example, Gautami, when she said from 1 drop to it increased to few more drops, I saw the excitement in her voice, So, and she explained very nicely also. She said every single day counts for her because she's already, her baby was some 10 months old or something, she mentioned. Yeah, so she was like, and she was very keen about it, even though her family said, it's okay, fine, no need. But she's very keen about it. So I would say it's up to individuals. If they seriously want to, take up the challenge, and may ensure that increase their breast milk, yes, It is possible, because
Yes.
for me it was not a biggest
Yes.
challenge. For me it was, concern was smaller, I felt, when
Yes.
compared to
Yes.
others. Okay,
Correct.
but when I saw the others, literally one female said from zero she started, and now 20 ml or 30 ml that is all good results, I would say. Yeah, very good actually. I think it was Ankita or someone. So
Yes.
very good results. So
You know,
uh, and
you
I
have.
was actually surprised also with that
Mm.
result. Actually,
Yes. Yeah.
zero
And
to, yeah, something that was very good.
see, you have to understand, when we are running a race, if you are on the surface and you are running, that is easier. But suppose if you are in a ditch, ditch, and you have to first come on the surface and then you have to run, it becomes very difficult to come out first.
True.
And with the mothers whose milk supply has gone nil, it is so
Yeah.
difficult first to motivate them, because their
Yeah.
mindset
I feel
is
first they would
very.
have lost their hope, first of all.
Yes.
Okay.
It
But
takes
when I
time for me to
see,
first motivate them.
yeah, when I see these girls telling, yeah, they're finding, they're able to, see the results, I was actually, I myself was surprised
Hmm.
with that.
You have also seen, first 5 days, many of them were not following anything, because
Yeah,
that is the
true.
mindset, because they are so negative from inside, whether it will work or not. And
Yeah,
when we had this fifth day call, and when we discussed the importance of everything, and they started doing, the 10th day they had results. So
yeah,
main thing is
correct.
doing. And this the main purpose of this challenge is to motivate them and be in a group, so that everybody is doing together and you don't feel lonely walking a path.
Yeah,
That was the
true.
main issue of doing that.
Yeah, that is there. Yeah.
Thank you so much. Thank you so much, Madhumita, for coming
Yeah.
live and sharing your journey with us, with all the mothers. And I am very sure they are going to be motivated by this, and it will be very helpful for them.
Yeah, ma'am. Thanks a lot to you, actually.
My pleasure. Okay.
Yeah.
Take care. Take very good
Yeah.
care of you, your baby, your family. And what should I say? Happy parenting journey and happy breastfeeding journey.
Thank you. Thanks a lot, ma'am.